HCA Healthcare is one of the largest providers of healthcare in the United States. We are proud to have over 31 million patient encounters a year, served by over 98,000 nurses. Our strategy is driven by one focus, and that is we're focused like a laser beam on the patient and the care that we provide. We want to make sure that we are providing the latest and most innovative technologies so that we can provide the best outcomes and the best care for our patient. We also want to enable the nurses to be able to spend more time at the bedside, and we provide information that they need as quickly as we can. We provide them the tools that they need to do the great care, and we make it easy for them to collaborate with their care colleagues. Information Technology Group, ITG, and nursing have been collaborating on a nursing strategy for a number of years, and we collaborate at an executive, a leader, and a care partner level. At the executive and leader level, we collaborate on the strategy and the prioritization of the work. We develop the business cases together, set the metrics for success, and prioritize the work and the sequence of the work. Our nursing leaders take point on understanding the people we are serving, and that means our patients and the clinicians, especially the nurses. Our ITG partners take point on the technology, understanding what the technologies can do for us and making sure that they work appropriately. And both ITG and nursing collaborate on the processes, making sure we understand the clinical workflows and how they should be represented in the technology and understanding how they should be implemented so they can be well adopted and serve our patients.
The nursing technologies at HCA Healthcare improve the efficiencies for our nurses, which ultimately allow our nurses to spend more time at the bedside with our patients. One of the technologies that is a big win with our nursing staff is a platform called iMobile, where they can have secure text messaging. It allows them to communicate with the entire care team at their fingertips. They will also get messages directly sent to their iMobile devices around the patient's status, so they don't have to log into a computer. It's right there at their fingertips. Additionally, they're able to get text messages sent from the patient, so when they use the call bell system, it alerts the nurse directly. So in the end, it just continues to improve efficiencies. A couple technologies that we have at HCA that are evolving and that are monitoring our patients to determine if there's deterioration and sending messages appropriately to our nursing staff include Mural. Mural is a technology that lives in our women's health space. This monitors a laboring mother's vital signs, and it alerts the nurse if the vital sign, particularly the blood pressure, is being elevated so that the nurse is aware of the patient's condition. Additional technology is Spot. Spot is the ability to monitor our patient's vital signs and send alerts if that patient is moving into a sepsis state. So the nurse can produce other interventions, discuss that with the physician, and then act appropriately based on that patient's condition. So looking at our vital signs, using our technology to help inform those actions. And finally, a technology that we have is Heart. Heart is integrated with our telemetry system, and it produces alerts to the nursing staff if there's arrhythmias that need to be sent to that nurse, particularly sensitive ones, so that we can respond real time, quickly, and resolve any of those challenges that the patient's facing. So as you can see, we continue to evolve our technology and focus on our patients.
There's many ways that we partner with our IT colleagues across the organization to engage not only our nurses, but our entire care team. We have an Orbit technology that allows our leaders to round on colleagues so we can really understand their needs. We've launched the Inspire app, which helps as a communication platform for our colleagues, as well as connects them to social media and helps them with career pathing. We recently sent care teams into our hospitals, which was a partnership across the organization to understand pain points for our caregivers. And we had 23 different process changes that came out as a result of that. And then the last example I would share with you is our hackathon, Coding for Caregivers. That was a partnership between IT and nursing. We had 5,000 submissions, over 5,000 submissions from our nursing colleagues across the organization that resulted in 8 different technologies being put into place.